As a child, I suffered from video game addiction, which saw me spend nearly over 6 hours a day on the screen. My parents went out of their way to help break me out of this addiction. Some of the activities included the introduction of outdoor sports, as well as just spending more family time together. The creativity in their handling of the issue is what inspires me today. Alcoholism is an addiction that affects the normal functioning of the body and requires creative remedies to overcome it. I've done the research and found many credible sources that point to the use of MDMA for recovering alcoholics. First, I will inform you of MDMA, its psychotherapy uses, and will finally conclude with the impact that its controlled use has on recovering alcoholics. First off, MDMA is a ring-substituted amphetamine with structural similarities similar to mescaline, as defined by Thal and Merriman in their 2018 article. It is crucial to focus on the history and its evolution to usage in psychotherapy. MDMA was first synthesized in 1912 and consequently patented in 1914 by the German pharmaceutical company Merck KGaA while they were trying to identify blood-clotting agents. After numerous tests, it did not work as desired and was therefore set aside. Research of the substance was studied in 1978 to reveal the positive cognitive effects that the drug could possibly have. In a controlled clinical setting, the positive cognitive effects of this substance included enhanced mood and well-being, extroversion and improved social ability, as well as happiness and relaxation. The desire to achieve the effects led to the abuse of the drug in the market. The Drug Enforcement Agency consequently categorized it as a Schedule I drug. From there on, MDMA would be more commonly known by its street names, Molly and ecstasy. With that critical understanding of the history of MDMA and its evolution to the use of a recreational drug, I will inform you of the use of the drug for psychotherapy, especially in PTSD. The Scientific American article on MDMA's journey from Molly to medicine by Alfonso Serrano highlights the successful use of the drug in the treatment of PTSD by war veterans. Its use in psychotherapy is due to the impact on different parts of the brain. Each different part affects different hormonal discharges. MDMA limits the amygdala, which is the fight or flight response part of the brain. In essence, controlled use of the drug reduces fear as individuals confront their traumatic memories. This makes them speak more to the therapist without feeling danger and is consequently instrumental in the final prescription given. The 2013 article by Jerome, Schuster, and Yazar highlights that the use of MDMA increases the empathy levels of the users, consequently allowing them to interact better in society. They will now seek for ways not to harm both themselves and others. This is highly beneficial as they try to reacquaint themselves with a normal functioning society, especially after some serious PTSD. Alfonso Serrano highlights the process used by psychotherapists as they handle patients and their MDMA usage. The patients decide the course of the treatment and the specific dosage that they require based on their interactions with the therapist. Controlled exposures reduces the probability of abuse and is instrumental in the success process. Now that we've gone through MDMA and its evidence-backed use in PTSD psychotherapy, I will tell you the uses of the drug in reversing alcohol abuse amongst users. A 2019 article in The Guardian by Helena Blackstone revealed that the use of MDMA alcoholism treatment significantly reduced the amount of relapses. Basing on the article, I will show you the success in the treatment offered and how MDMA impacts alcohol users. 8 in 10 alcoholics relapse in England under standard treatment approaches. The success of any alcoholism treatment is based on the relapse that ensues. The controlled use of the MDMA resulted in promising results taken after 9 months of the treatment to measure the relapse levels of the individuals. The use of MDMA for alcoholism treatment revolves around clinical sessions undertaken weekly to gauge progress and allow for impact to happen. According to Sam Blackard, a reporter at the Daily Mail, the typical session involves a consultant psychiatrist and a clinical psychologist. After the administration of the drugs, there is the observance of the patient's behavior over the next 24 hours to help them determine their specific reactions. Psychotherapy deals with addressing the trauma that is facing the individuals and is this undertaking that allows for the use of the drug. Addiction mostly stems from underlying trauma or previous scars that we have never healed, and the use of trauma-focused psychotherapy breaks these. MDMA suppresses fear and allows for the use of for the speaking on traumatic issues, thus allowing for success in the interactions between the various parties, or the therapist and the user. So far, we've gone over the synthesis of MDMA as well as its development for use in clinical psychological settings. We then went through the use of the drug in psychotherapy as well as MDMA's role in the elimination of relapses in alcoholism treatment. Now that you understand MDMA's clinical benefits, it is possible to recommend its usage for the treatment of alcoholism. Ecstasy's abuse should not make you disregard the clinical benefits it possesses. It is all about the creative solutions to the problem at hand.